This is the 7th edition of the MFAS. The goal and the objective for this is to spur public debate in facilitating a conversation on how the government is allocating and spending public resources. This is a thorough research and a highly analytical product, and we try to synthesize it in a way that most of us can interpret, most of us can demystify, and also engage the necessary audience in conversations about public finances in Kenya.
The snapshot that we have here reminds us that Kenya's economy remains relatively resilient. The medium-term growth is projected at about 5%.
As we speak, about 43% of Kenyans cannot earn or cannot afford $3 in a day. 43%. So imagine in a population of 55 million people, we are talking about over 20 million people who are living in poverty. So that technically means we have growth that is not shared equitably in this country. It's high time that the government be deliberate in addressing the inequality that we have in Kenya and also cushion the vulnerable.
The most obvious thing that you're noting is that the macro environment and the GDP growth, at least according to the official figures and projections by international organizations, is stable. But then this has not necessarily translated into improved welfare for households, and this is evident in suppressed consumption. And I think if Bernard went further to look at how well our tax heads are performing, VAT is one of those tax heads that is suffering because consumption is not as high as it could be.
If you look at the primary healthcare fund, there was an increase of about 85% of allocations. If you look at the emergency critical and chronic illnesses fund, there was an increase of 60%. What will be interesting for us to look at is the execution of these funds at the end of the financial year. Unfortunately, we see a mixed and uneven commitment by government towards vulnerable populations. We see that the allocations to the health insurance and subsidy program actually increased by about 92%. But interestingly, we see that the number of targeted indigents as older people and persons with disabilities declined by 20%.
Over time, our revenue has been growing at an average of 9%. It's a good thing, but still, government has been over-projecting revenue. Once you over-project the revenue side, you give room for a deficit that won't be covered by the revenue side. So we borrow more at the end of the day.
The national average is 5% of children under the age of 5. But if you look at the ASAL counties, it's nearly 4 times as much. For example, in Marsabit, this is 20%. In Turkana, this is 23%. In Wajir, this is 23% as well. And so there is a need to, again, equitable investments towards in nutrition.
The central message of this report is that the stability has not translated into shared prosperity. That came out very clear. For many Kenyans, recent years of macroeconomic stability have coincided with the following. They have seen higher costs of living. They have seen declining real wages. We have also seen insecure and informal employment. We have seen reduced access to quality public services.